Hello everyone. Hello everyone, and welcome to this audio podcast. This audio podcast as part of a bulletin beat. This audio podcast as part of a Squadron Bloca. This audio podcast as part of a PLCE Ebonics, and this audio podcast as part of an interlude. In this audio podcast, interlude, there will be an overview in around pyelonephritis pyelonephritis or PN, and also sort of acute, looking at acute pyelonephritis or PN as well. So to begin with, pyelonephritis is generally a sort of a condition that is that relates to or is in regard to infection and a sort of an inflammatory process, if you will, that begins in the that can begin in the sort of lower urinary tract and move up into through the into the sort of main renal anatomy and renal pathophysiology through through ureters, involving sort of the surrounding renal parenchyma. If it's not treated, it can cause renal damage, and the sort of renal damage more specifically is something that's referred to as renal hydroplasia, and with the renal damage, there can be sepsis and potential risk of sort of long-term tract renal tract scarring. Most common causative agents are gram-negative bacteria, with most cases cases sort of presenting with E. coli or Escherichia coli. Other less sort of common pathogens can include Proteus, Klebsiella, Pseudomonas, Enterococci, and Staphylococci. The presence of fever is and can be an indicator of sort of both sort of direct and indirect renal involvement. Febrile urinary tract infection is sort of another name or an alternative name for pyelonephritis or acute pyelonephritis or APN. One of the most sort of serious pyelonephritis generally is perhaps one of the most serious bacterial illnesses or conditions in pediatrics or the young people, and in older pediatrics or those who approach sort of adolescence. For example, acute pyelonephritis or APN may result from where there can be voiding disturbances, including hyperactivity and dysfunctional bladder emptying as well. Around acute pyelonephritis or APN, so there are generally two forms. There's acute uncomplicated, and then there's acute complicated as well. So with acute uncomplicated, there's mild to moderate illness in patients with morbidity disease. In patients or recipients without morbidity disease, and the majority of cases can occur in females in females or women ages 18 to 40 years, and in generally around the sort of urinary tract and renal tract, female versus males, for example. The urinary tract, or the ureters, ureters or and the urethras, in females versus males are shorter, by a certain number of centimeters, owing to specific anatomy, and generally in females, and especially in pediatrics, and young people. Unfortunately, there's again majority of sort of incidences and prevalences around acute pyelonephritis, or pyelonephritis, occur owing to where there's a pre sort of dominance in and around females, females versus males, owing to particular bacteria, particular infections and bacteria, and also again around in and around the urinary tract. In regards to related to acute and complicated APN, or acute pyelonephritis, recipients can have an underlying condition that increases risk of therapy, of treatment therapy failing. Pregnancy, and recipients who have gone under transplantation, acute kidney injury or AKI, and chronic kidney disease or CKD, functional or anatomical urinary tract abnormality can also abnormalities can also cause issues in sort of in and around the susceptibility around acute pyelonephritis as well. Around the sort of the etiology, so most cases of APN result from the entrance of organisms through the urethral, periurethral tissues into the bladder, with subsequent invasion of renal pathophysiology. Urine flow, including what's referred to as micturition, or the sensation of where individuals or recipients have the sort of sensation of wanting to void, usually prevents infection, because washing out sort of the bacteria, washing out the sort of bacterial suspected bacteria through the urinary tract can help dissipate the infection or potential infection through the urinary tract. The most important condition associated with acute pyelonephritis or pyelonephritis is the presence of, again, sort of the anatomical, renal, and urinary tract abnormalities, such as where in recipients there can be a pre sort of dominance around tract scarring, and conditions such as vesicourethral reflux, and in a sort of a follow-up audio podcast, there will be an overview around vesicourethral reflux as part of this particular series, and so on in line with line 2, acute pyelonephritis or APN. There is chronic pyelonephritis as well, and it's a consequence of sort of a repeated or untreated complicated acute pyelonephritis. The underlying etiology is mainly structural, unfortunately, or structural abnormalities such as congenital abnormalities of the renal and urinary tract. The presence of a sort of sharply delineated or geographic scarring around the tract or urinary tract can be one of the main sort of bases for chronic pyelonephritis. Around the clinical diagnoses, so history and physical examination are perhaps perhaps some of the most useful aspects for diagnosing APN. So history is the history around the diagnosis. It consists of where health professionals look to identify issues around lower urinary tract symptoms. So for example, frequency of voiding, urgency, and dysuria, for example. Upper urinary tract symptoms as well. Constitutional symptoms, and also gastrointestinal symptoms as well. Physical examination, for example, where it's important to where it's important for health professionals to get a basis around whether individuals or recipients have fever, cost of vertebral angle tenderness, tachycardia, and also symptoms around hypertension. In relating to sort of the treatments, so short treatment with or treatment or short treatments with intravenous antibiotics in severe cases or serious cases it can be implemented up to sort of where recipients can have sort of intravenous antibiotics up to 4 days, followed by oral therapy or oral treatments. Guidelines for the treatment of pediatric or childhood acute pyelonephritis have recommended oral antibiotics for pediatrics who are older than 2 months, unless the child is seriously ill and unable to sort of tolerate antibiotics. Oral antibiotic administration is recommended in sort of the outpatient setting. Hospital admission for intravenous therapy is recommended for pediatrics in sort of where the symptomology is can be complicated, and where there can be sort of other worsening clinical sort of symptoms as well. There is no sort of gold standard antibiotic treatment, although it can vary between sort of countries in relating to in relating to sort of for example pediatrics, and sorry, in and around pediatrics, and also for example around sort of microbiology and sort of bacteriology sort of practices and evidences as well. Empirical antibiotic treatment should be sort of investigated soon after acute pyelonephritis, pyelonephritis or APN is suspected upon urinalysis and where there are symptoms. And steroidal treatment it can be used to prevent sort of the sort of challenges around tract scarring. In and around recurrence and prevention, identifying major risk can allow for the implementation of preventative measures to reduce the risk of recurrence and preserve renal function in sort of suspect recipients, and in particular again in pediatrics where pyelonephritis and acute pyelonephritis can be a general sort of challenge. Factors associated with recurrences have been documented or evidenced where there's a sort of a sort of a Caucasian or white race predominance, and where there's an age between pediatrics or young pediatrics and adolescents. Sorry, pediatrics in between ages 3 and 5, and also where there's pyelonephritis, and grading of acute pyelonephritis, where there's a grading between grades 4 and 5, and aligned with evidence around vesico-urethral reflux. Excuse me, and also risk factors associated with recurrence are also sort of evident where there's a sort of where there's family history of urinary tract infection or UTI, dysfunctional voiding syndromes, and poor fluid intake and functional stool retention as well. Antibiotic prophylaxis is used to prevent recurrence in pediatrics after acute pyelonephritis is and has been sort of pertinent, especially where vesico-urethral reflux is or has been detected. Antibiotic prophylaxis also has been associated with an increased risk of resistant bacteria in pyelonephritis and acute pyelonephritis cases. Related to sort of the clinical manifestations, so symptoms of acute pyelonephritis in pediatric recipients is variable and is influenced by the age of the child, the sort of virulence of the organism, and the inflammatory response surrounding the immune system. So fever and dysuria and a sort of a malodorous and cloudy urine and urinary incontinence. These are sort of the preliminary sort of markers of where health professionals would investigate potentially pyelonephritis or acute pyelonephritis, and where there's in pediatrics in pediatrics or neonates even, where they are 2 months or 2 to 3 months old or age in that age, at least where there is specific sort of tract or renal tract abnormalities, from an anatomical basis. And aligned to that, where the investigations should follow, if and where there's sort of a labile temperature, slow feeding or poor weight gain, and irritability, lethargy, hypotony, abdominal pain, and nausea and vomiting. And then pediatrics with ambiguous symptoms have been sort of reported to be at higher risk of complications, and complications can include sepsis and even sort of meningitis as well. So the summary around this, around pyelonephritis and acute pyelonephritis. So oral and intravenous antibiotics are generally equally effective in most pediatrics. In most pediatrics, and prenatal ultrasonography or radiology has revealed or can reveal that major can reveal sort of the major renal damage in pediatrics, and where there's where there can be where the tract damage or scarring, it can be related to the presence of urological abnormalities as well. Antibiotic therapies can help in resolving acute infections without complications. The long-term outcome of acute pyelonephritis is mostly related to the appearance of renal or tract scarring, and just a small minority or a minority of pediatrics, at least in some sort of retrospective data, has highlighted that deterioration of renal function can lead to CKD after an acute pyelonephritis or pyelonephritis diagnosis is made, and thus health professionals should prompt a follow-up on that basis.